This short presentation is recorded to share some of the findings from a study conducted in the Ottawa region in Canada. Dr. Itoa, the principal investigator, is an associate professor with the University of Ottawa, and Selma Debs-Ivall, the co-investigator, is a project manager with the Ottawa Hospital. Within the context of globalization, today's nurses are confronted with a patient population and a set of professional values that require special skills for negotiating cultural boundaries. The ethno-cultural composition of Canada's population has grown constantly throughout its history. It is one of the most ethno-culturally diverse nations in the world, especially in the major cities and urban areas. In 2006, 1 in 6 of the Canadian population were self-identified as members of a visible minority. A further 3.8% self-reported an Aboriginal identity. The 2006 census data shows similar growth in diversity within Ottawa, where 22% of its population identified as immigrants, 22% reported a mother tongue spoken at home other than English or French, and 44% were first and second generation immigrants over the age of 15. The increasingly culturally diverse face of Canada calls for equity within and across visible and non-visible populations, and an integration of diverse views into both the socio-cultural and professional spheres of Canadian society. An understanding of cultural diversity is vital at all levels of nursing practice. Reflective groups are a unique feature of nursing professional practice at the Ottawa Hospital, where like-minded nurses come together to discuss a topic of interest and passion to them. They become the brain bank that houses the latest knowledge in that specific area and that can guide organizational policies and practices. The Diversity and Social Inclusion Reflective Group of the Ottawa Hospital is a group of nurses from across the Ottawa region who have a passion for the topic of diversity and social inclusion. This group of nurses wanted to know the current status of diversity in the Ottawa region and proposed the following study. The title of the study is Exploring Diversity in Nursing in the Champlain Region, a Capacity Building Initiative. The purpose of the study was to explore the current state of knowledge about diversity among nursing professionals in the Champlain region in Ontario, Canada. The group wanted to be able to use the results of the study to raise awareness about culturally relevant care and to mobilize the nurses in the reflective group and beyond to form a network of experts that would be called upon to engage in research and guide initiatives that would strengthen cross-cultural healthcare. The study became one in a series of qualitative research studies led by Dr. Itoa, examining the work-life experiences of registered nurses in relation to cultural diversity in healthcare from their different social locations. The first study, completed in 2005, examined the work-life experiences of black nurses in Nova Scotia. A second study, completed in 2008, explored the work-life experiences of visible minority nurses in Nova Scotia. And a third study examined the work-life experiences of Aboriginal nurses in Atlantic Canada, with emphasis on how their Aboriginal identity influences the quality and nature of their experiences, and was completed in 2010. The current study is the fourth in the series. It examined the state of ethno-cultural diversity from the perspective of Caucasian nurses within the Champlain region using grounded theory research that was informed by the tenets of participatory action research. The sample consisted of 21 nurses who self-identified themselves as white Caucasian and who represented all levels from frontline nurses to senior VPs within the organizations. The interviews took place over the period of a month and were guided by theoretical sampling. The data analysis utilized a constant comparison process that was facilitated by the use of Atlas TI for qualitative data management. The study took place in the 5 academic health sciences centers within the Champlain region and was hosted by the University of Ottawa School of Nursing. The 5 centers include the Ottawa Hospital, Children's Hospital of Eastern Ontario, Bruyère Continuing Care, the Royal Ottawa Healthcare Group, and Hôpital Montfort. The already established relationship between these institutions and the University of Ottawa, including joint appointments and student placements, facilitated the research process. Registered nurses who met the study criteria were recruited through already established networks in the healthcare community, and the use of recruitment posters placed in public areas within the healthcare facilities. Purpose of sampling: theoretical sampling, and snowball techniques were used to recruit 3 to 4 participants from each of these 5 sites, for a total of 21 white nurses. The findings of the study are organized under 6 main themes, namely workforce diversity, organizational and leadership commitment to diversity, meaning of diversity, cultural competence, properness of diversity discourse, and discrimination and racism. For this presentation, we will concentrate on the themes of workforce diversity and organizational leadership and commitment to diversity. 2 sub-themes emerged under the workforce diversity theme. These are current state of workforce diversity, impact of workforce diversity. Many of the white nurses participating in this study expressed an awareness of the increasing differences in demographics within their workplace. Diversity decreased the higher up the hierarchical organizational ladder you were. The nurses considered diversity in terms of the language many co-workers worked in. That is, they acknowledged that many of their diverse colleagues worked in their 2nd, 3rd, and even 4th languages. They also expressed their awareness of how individual upbringing influenced co-worker support for diversity initiatives, and that an institution's administrative style influences the strategies that could or would be taken to address workplace diversity issues. One nurse remarked, "I would say that when you look at the top of the administration, managers, directors, not a lot of black people." When prompted about diversity at the management level, one nurse responded, "Managers and head nurses? Not diverse. No diversity, not at all. I can think of the different units, but there is not a lot. No, not a lot." In regards to upbringing and its influence on attitudes, one nurse remarked, "I was born and raised in Ottawa. I've been exposed to other cultures. I've never had any problem with that. It was part of everyday experience with family, friends of my parents, friends of the family, and school." Another nurse noted, "It's all due to my upbringing." The participants shared their perception that the organization's culture and leadership style influenced the strategies that could be adopted to address workplace diversity issues. One participant commented, "We probably don't talk as much about cultural diversity of colleagues that we're working with, or even have that kind of perspective around it." Under the 2nd sub-theme, nurses participating in the study provided descriptions of their day-to-day experiences with diversity, which were both positive and negative. They commented on how learned professional values can be a barrier to understanding and accepting diversity vis-à-vis patient care delivery, as well as influencing their interactions with diverse colleagues. They articulated their concerns in addressing diversity because they felt that efforts should go both ways among and between white and diverse nursing colleagues. They mentioned that differing worldviews and the variety of individual backgrounds impact what is considered a diversity issue. They also warned of the difficulties arising when competency issues are confused or misrepresented as diversity issues. Nurses also described how diversity issues impact on the provision of patient care. They commented on how diverse learning styles among co-workers influence the strategies selected to address diversity issues, whether related to patient care or interacting with colleagues. Moreover, they expressed their concerns about how established Canadian ways of providing patient care would be threatened when addressing diversity issues. It was obvious that the nurses valued what they termed the Canadian way of delivering nursing care, and expressed their concern about the influence of other ways of care delivery on the Canadian or North American way, implying that other ways are not of equal quality or value. One of the nurses commented, "And if you have to deal with 3rd or 4th or whatever your language is in your work, you know this is really stressful." Another nurse stated, "Some of those people completely don't get it. You know? What is important for people here? What are they? It's the North American way of life." Nurses expressed their need to continue to maintain the Canadian way of nursing by teaching it to the internationally educated nurses who join the ranks as the right way of doing things, because of the fear that different values will permeate the care. One nurse commented, different values of people from cultures that take the time to give the care to patients, while Caucasians deliver care differently to patients. Another said, I guess when we know that people are coming directly from another country, new immigrants, and the way we're doing that is to teach them about the Canadian society as we Canadians see it. This workplace environment is further complicated by the white nurses' fear for their jobs, as they perceive that the internationally educated nurses are a threat to their job security. As one nurse put it, so what is that going to mean for those nurses? I don't know. A lot of them are very frightened for their jobs. Nurses commented on having witnessed discriminatory behaviors among colleagues. One nurse shared her experience with colleagues who do not accept diversity. I know a lot of people that we're supposed to be accepting within my peers. I find that a lot of people are still not accepting. Other nurses shared their frustration when nurses speak a language that is foreign to them and how it makes them feel excluded. I have some difficulty when peers from the same culture or the same country are talking in the language of their culture. I find it really a negative aspect in regards to Canadian peers, because people would go and work in a silo. Like I don't go around speaking Italian to anybody. Yet others felt that we need to equip nurses from visible minority groups to deal with the racist behavior that is directed towards them. It would be really helpful to focus on instances and just to make sure that they are helped and given the tools on how to deal with people who come across as racists. The more experienced nurses shared their perspective that the collegial relationships between nurses has improved over the years, to the extent that some no longer even notice it. We probably don't talk as much about cultural diversity of colleagues that we're working with, or even have that kind of perspective around it. Some have noted that even though they still have a long way to go to become culturally competent and accepting, they have noticed some improvement from the past. We have a long way to go, but we have come a long way. I think now the complaints that people were saying about human rights violations are not as obvious as they might have been at one time. Nurses also shared their perspective about the impact cultural differences have on interactions with patients and colleagues. One nurse commented, the majority of all those troubled souls are white Caucasians, or people who don't like colored people. That's the reality. Older people are not necessarily sensitized to today's reality. They have a very difficult time when they're hearing heavy accents and can't understand what the care worker or healthcare worker is saying to them. Another nurse shared, when you're struggling to understand a colleague and when you're struggling to understand a patient, if you don't have a facility with that particular culture of awareness, that there may be a cultural difference that you need to check out, the tension can run really, really high. The second theme for this presentation is organizational and leadership commitment to diversity. It refers to the acknowledgement or awareness among white nurses of existing institutional policies dealing with diversity, as well as an articulation of the responsibilities that institutional, organizational, and professional leaders have to promote understanding and acceptance of diversity in the workplace. This includes the existence of specialized resources to support diversity. 4 sub-themes were identified, which include diversity policies, leadership commitment, organizational culture, and resources to support diversity initiatives. Awareness of the existence of diversity policies within employing institutions by the white nurses participating in this study ranged from a total lack of knowledge about such a policy to a precise articulation of it or its equivalent. No, there is nothing in the area of cultural diversity that deals with race and ethnicity. We have a harassment policy, but we don't have anything that actually addresses diversity. Interestingly, the least knowledgeable about the availability, or lack thereof, of diversity policies were frontline nurses, whereas the most informed were senior managers and administrators. Of note, none of the organizations in the Ottawa area had diversity policies. Nurses shared with us that their organizations had codes of conduct, respect in the workplace policies, anti-harassment and anti-bullying policies, but nothing specifically on diversity. They have a code of conduct, that's it. Everything is broad. We have a code of conduct. We have respect in the workplace. We have broad policy. Are they targeted specifically? No. But could we extrapolate from that and use those policies as foundation of policy association? Absolutely. Examples of existence or absence of institutional policies on diversity were more precisely articulated by nursing managers, educators, and administrators, who, incidentally, were the ones to address diversity issues within their teams. We do not have diversity policy per se, because this organization has had diverse staff a lot longer than diverse decision makers. I know that we have a policy on official languages, French and English. If there is a conflict, the clinical manager has to address it. I don't have to do anything on my part. And if the clinical manager is not available, nothing else can be done until that person is available to address the issue. While many of the nurses, regardless of whether they were frontline workers or more senior managers, were aware or unaware of the existence of diversity policies within their employing institutions, virtually every nurse commented on the necessity of buy-in from their organizational and professional leaders to support and promote the creation of such a policy in their workplace. A number of nurses felt that institutional, administrative, and professional leadership was critical for supporting any initiative, including diversity initiatives. We have a CEO who was always ahead of himself, even when he was looking at the construct of our board of trustees. He's very mindful to have a blend of how many males, females, how many English, French. I think he's raising the level of awareness at all levels within the organization. A few of the nurses also shared experiences where organizational and professional leaders were detrimental to any policy effort. I think in our place, the staff is demoralized. They do not perceive that they are all respected by senior management in their contributions to the hospital. Indeed, nurses felt that an accepting workplace environment would attract the diverse staff and is influenced by the leadership. This organization is really very open. It's a place to be. If you want to become a leader, this is the place to be. Of interest, some of the nurses shared that their understanding of embracing diversity was to hold multicultural days where those nurses from countries other than Canada would wear their folk dress and would bring traditional food to share with their colleagues. One of the nurses shared her organization's strategy. They had cultural awareness all the time. We used to have multicultural days. On multicultural days, people will bring a dish that is from their cultural background. They will have this great potluck dinner. Another nurse commented about the need for celebrating diversity and her idea of what that would look like. You know, there is nothing stopping us from doing something like that within our different facilities. Like, we can have multicultural days. Shouldn't we enjoy potluck and have senior management involved in it as well? The views shared by the white nurses participating in this study described organizational cultures that either created barriers to incorporating policies on workforce diversity or that enhanced efforts to integrate it. Insights were provided as to how the corporate policy language of their facility functioned as proxies or code words for understanding, accepting, or promoting diversity. These proxy terms fell under corporate and institutional values, personal values, codes of conduct and ethics, inclusionary and exclusionary practices. Corporate values that were used as proxy to cultural competence included the value of person-centeredness, as well as organizational values. One nurse commented, "The thing is, when we talk about diversity in terms of whatever, it is because in a sense it's person-centered. Because it does respond to any issues of diversity or culture, or any of that kind of things, or in a sense, if you think of person-centered, transferred in a way diversity, or you're with the person, then you're culturally and ethnically sensitive, you know, sort of." Another nurse said, "I remember when they introduced the values in the hospital, right? You know, those values will affect people coming from different countries differently. As an organization, you cannot impose something on people, but you still need the corporate kind of line that needs to be followed, whether it be on professionalism or the values of the hospital. Other nurses felt that organization values need to reflect the need for inclusivity in discourse and decision-making. I don't know of a policy that says we need a visible minority at the table to do anything at this point of time. I don't think we are there. There is such a shortage of people working in the institution. Basically, we have to make do with whoever is there. Personal values were also used as proxy to cultural competence as addressed by workforce policies. As one nurse put it, I think that knowing who you are, what your values are, what your work ethics is critical, because when you have good values and good work ethics, you have good relations with your colleagues. You will see that your colleagues, whether they're white or black, will respect you enough that you wouldn't even be afraid to make comments. Organizational barriers to embracing diversity included shift segregation and attitudes towards differences. One nurse shared that different cultures are working days. As you can see, mostly in days you have Canadian educated nurses, and in the evening and night you have nurses from different countries. Another nurse identified differences as barriers. She states, if you get two different cultures or two different backgrounds, there might be some misunderstanding, because they don't know why some people may do things in certain ways. There might be wrong interpretations on the way things are done, so this may create conflict. Nurses identified the organizational professional codes of conduct and ethics as proxies to organizational policies around diversity. As nurses put it, so I would expect that a code of conduct would show that there would be aspects of respect for the individual. Respecting an individual means respecting who they are, their ethnicity, their cultural background, having a better understanding. For new nurses to Canada, we need to explain healthcare in Canada, and we need to have very clear expectations that we have a code in CNA, even a code of conduct, and some of the units in the hospital have done that, because we will not tolerate this or that, and it should be across the board. Most study participants acknowledged their lack of knowledge around this issue, and the need for more resources to promote understanding and embracing workforce diversity. I feel very uncomfortable with the topic because right now I realize how very little I know. I think everyone should take cultural sensitivity training. I think they should be offered because our society is changing. There's so much integration today, so we have to change with it. Nurses caution that consideration should be given to the generational differences in the knowledge and experience of diversity. Many older white nurses have had limited experience with diversity either in their nursing training or in their workplaces throughout their career. I don't think the older nurses will be able to cope with it, with the change of it. I mean, some will, but I think the majority won't. Here are some additional quotes from the participants. I know that over the course of the last several years, we have been consulting the units to have a better understanding of cultural diversity. Several years back, there was some interest in having a cultural committee to increase awareness, to focus on marketing the whole idea of cultural competence, like an ethics committee. But then that did not take place. There are many of us who had very little, if any, education in cultural competency. There are no data on what resources we have within the institution. We have no data on what resources are available within our community, per se. The next few slides will cover two of the remaining 4 themes very briefly. The third theme, the meaning of diversity, refers to the differences between participants as they attributed their own personal perspective to defining diversity. Their definitions reflected personal values, beliefs, and comfort with the paradoxical nature of diversity. Diversity is about human beings. Every human is different, and that makes it so interesting. Everybody has their own story. Everybody has their own background. Everybody has different nuclear family. Diversity also shows in different literature and different ways of doing research, different ways of doing things, different lifestyles and different cultures. Even in the same culture, you can have different diversity because you can have different religious backgrounds, You can have a different experience growing up, even in the same culture you might be growing up in. Many nurses felt that they cannot fully grasp or define diversity. As one nurse put it, I would say, by and large, I don't have a clear understanding of that term and what it really means. I guess it's because we haven't entered into the conversation of what that clearly means. The fourth theme refers to the perceived concern among nurses of the appropriate language to discuss issues of diversity. It reflects the political correctness or culture of avoiding difficult and uncomfortable discussions related to diversity and racism. Nurses were uncomfortable with and avoided the use of terms such as race or ethnicity in discussions, or spoke around the thorny issues, wrapping them up with words such as diversity and difference. Here are two quotes that reflect this discomfort with the terms and their implications. I don't even know what term is appropriate. My big concern is that I don't want to offend anyone by having the wrong terminology. We're in a politically correct atmosphere in Ottawa, and I didn't quite see this narrowed down in the hospital environment that was talked about a lot in the public until now. The findings from the study revealed that creating an environment of inclusion for a culturally diverse nursing workforce is complex. However, there are some steps that are essential to moving forward. These steps must include strategies around diversity policies, promoting cultural competence in clinical practice, and cultivating diversity leadership in management. Specifically, organizations need to build responsive and welcoming workplaces in which all feel engaged. Nursing leaders who oversee system changes need to create a workforce that reflects the emerging cultural groups in the population of the recipients of health care. We found that leaders and managers need to cultivate a team spirit informed by a broad range of culture-based values and beliefs that embrace inclusivity. Diversity training, mentoring of all staff and leadership development should be benchmarks of today's healthcare organizations and embedded into the very culture of the organization. Career advancement and succession planning that embraces a diverse workplace is vital, especially through promotion and mentoring. Recruitment and retention of visible minority and multilingual nurses should be accompanied by diversity resources to ensure healthy workplaces that are ready to receive and embrace them. We would like to conclude our presentation by sharing our belief that a true commitment to diversity leadership in nursing requires the creation of an environment where no one is advantaged or disadvantaged, an environment where we is everyone. The researchers would like to acknowledge the generous financial support for the project by the University of Ottawa and the support and hosting of the Diversity and Social Inclusion Reflective Group at the Ottawa Hospital. We thank you for listening to our presentation. Should you have questions, please do not hesitate to contact the research team at the following coordinates. Thank you and have a lovely day.